There are a few conditions in the Emirates which are quite uniquely prevalent here, which we don't see very commonly elsewhere in the world. Obviously, everyone knows about diabetes and the fact that diabetes is so common here. Probably a quarter of the local population has diabetes, and that is a huge number. That is second in the world in terms of how common it is. And we see a lot of patients with diabetic eye disease. The key message here is that if you have diabetes, it can and probably will affect your eyes, but that it is treatable provided it is diagnosed early. So the key message is to get your eyes looked at, get your eyes examined probably once a year with diabetes by somebody who has experience in looking at eye disease. We also have quite a high incidence of cataract, but cataract happens all over the world. Our experience is that it seems to happen a little earlier or at a younger age here than happens elsewhere. But cataract is pretty common everywhere in the world. You'd have thought that the effects of sunlight and the very dry, dusty environment would mean that we get a lot more eye disease related to that. And to some extent that's true, but not really as much as you would have thought. Having dry eyes, itchy eyes, burning eyes, that's very common in this part of the world. And we see a lot of patients with that. There's nothing much to be done about it except use lubricating eye drops, and these days people don't spend that much time out in the sun anyway. So in fact probably quite a lot of what we're seeing is related to air conditioning rather than sun and dust and the haze. But topical drops is enough to sort that out, and it's not sight threatening, it's not blinding as an eye condition. Another condition that we see quite commonly here, which we don't see elsewhere in the world, is a thing called keratoconus. Now this is where the cornea, the front surface of the eye, gets a little bit misshapen because the layers that make up the cornea are thinner than normal and are a bit more stretchy than normal. We don't know why it's so common here, but it certainly is. It's treatable, treatable with glasses, contact lenses, or perhaps surgery later. And treatment with a variety of different types of surgery can make a big difference. There are a couple of key messages which I think members of the general public really ought to know about in regard to eyes. One is the need to protect children's eyes from the bright sun. We don't realize how sensitive children's eyes are to sunlight. The pupils tend to be bigger than they are in adults, and the eye lets in a lot more light. So probably 60 or even 70% of all the light that's going to get into the eye during the course of your life is going to happen during childhood. And we don't know for sure whether this is damaging the eyes, but there is growing evidence that this potentially is going to damage eyes and cause problems many years later in adulthood. So what I would urge people to do is to try protecting children's eyes, and the best way to do that is really with a cap. Most children don't tolerate wearing dark glasses. They're awkward, they get broken, they get taken off. But a cap or something with a brim on it which protects the eyes from the bright sun or from the direct sunlight and from the sky, that can be very, very helpful. And I'd like to see that sort of worn habitually by children when they're outdoors. It's an insurance policy for the future. The second key message is to understand quite how damaging smoking can be to the eyes. We now have very, very good evidence that smoking causes, or not so much causes, but makes macular degeneration worse. Now, macular degeneration is a condition which affects people in their late adult years and is the leading cause of blindness in the Western world. It's very, very common. We don't see much of it here, but there is a strong association between macular degeneration and smoking. And I would be concerned that people smoking in their teens and 20s and 30s are storing up trouble for their future in their 50s and 60s, where they will have macular degeneration. And of course, by that stage, it's too late.
For more details, visit www.dhcc.ae or call 800-HEALTH. Dubai Healthcare City, setting new standards in patient care.